efforts of people. We heard about what happened in Winnipeg a few months ago where somebody waited, 24 hours in an emergency department, and when they finally got to him, he was dead. That hasn't quite happened to my knowledge in Toronto, but there have been lots of sick people where we've just averted disaster because they've had to wait too long. The other problems that are going to happen in emergency departments if we don't reverse this trend are we get another episode of SARS, and what happens? Where do we put those people? We get major disasters. Something happens out at Pearson with a plane. Where do the people go for that? We don't have, hospitals like to talk about surge capacity, the ability to cope with crises. Well, as you close beds, overcrowd emergency departments, we don't have that surge capacity anymore. We don't have the ability to deal with the unexpected. We also don't have the ability, we aren't dealing with getting the people who need alternate level of care, who are in the acute care hospitals, and by some estimates, 10% of people in acute care hospital beds can be moved to alternate level of care if that care exists. In some institutions, it's actually more like 20% who could be moved. We don't have that. So again, we're getting this backup into the emergency departments. That backup affects the quality of care that people get in hospitals. It affects the morale of people. A few years ago, you would see the fighting between the emergency staff and the ambulance staff, because the ambulance staff were bringing people to the emergency departments. They have no choice. The emergency departments have no place to put them, and you get into these shouting matches between the nurses, the doctors, and the paramedics. Why did you bring the patient here? We didn't have any choice. Well, you could have gone somewhere else. Well, we couldn't have gone somewhere else. And it escalates, and it creates bad feelings everywhere. Amongst the emergency department staff, people get burnt out. We've got senior nurses leaving the emergency departments because they can't cope with things any longer. They're frustrated, they can't do their job well, and the emergency physicians also get frustrated. So the bottom line, and I'll stop soon, or probably now, is that the longer we go on with the present course that we're getting, the more likely we are to see scenes in the emergency department of overcrowded waiting rooms, of people lying in the hallways, people getting inadequate care in the large hospitals or in the small hospitals. So I'll stop there. Thanks very much.
So thank you very much to Joel and Ray. Well, this is better than TV, right? Getting some analysis. And also, thank you very much for the glimpses into what's really going on in towns and cities.